Good afternoon, ladies and gentlemen of the press, fellow Kenyans. Yesterday, I updated you on the coronavirus disease outbreak in the country. We have called you again this afternoon to appraise you on what has transpired in the last 24 hours. Today, we have received confirmation of one more case of a patient who has tested positive for coronavirus. This brings the total number of confirmed COVID-19 cases in Kenya to 16. The latest is a close contact of one of the 8 cases we reported yesterday. The ministry, working with the county government, has traced 646 persons who had come into close contact with the confirmed cases. 96 of these contacts have already been released from our follow-up program after completing the 14-day follow-up period. Those remaining in our follow-up list are 550 persons. All the patients, except one who is at the coast, are still in stable condition and improving. 11 individuals are currently admitted at Bagathi Hospital awaiting test results. Yesterday, if you recall, we also addressed the issue pertaining to the public transport sector. We reminded those operating in this sector to adhere to the directive we gave on March 20th, 2020. It has come to our attention that several public sector transport operators have now resorted to increased fares as a result of this directive. I want to make an appeal to those in the matatu industry and others in the transport sector not to increase fares for our commuters. By so doing, it will be counterproductive as we continue to fight this virus in our country. You will remember that I had said from the beginning that every sector is going to take a financial hit in this crisis, and to expect that one sector is going to punish everybody else for them to maintain a scenario where they are earning as much as they could is immoral and unfair. And then therefore we are appealing to the matatu sector to kindly look at the situation, understand it, understand that the commuters they are carrying are not in the same position they were in prior to this. Some of them are not earning any money at the moment, and to appeal for their reasoning. As we indicated yesterday, we have suspended all flights effective midnight 25th March 2020, international flights, as one of the key measures to prevent importation of additional cases in the country. Let me reiterate that all passengers coming into the country between now and that day, Wednesday, midnight, must undergo mandatory quarantine, either at their own expense in hotels, in government-approved hotels, or in designated government facilities. I want at this point to issue an apology from the Ministry of Health and other government agencies that are involved in this exercise to the parents and the individuals who have been so inconvenienced since last night. We are aware that we had logistical challenges that we encountered as a result of the speed at which we wanted to move into quarantining individuals. And therefore we know that we inconvenienced people substantially, and for this we can only apologize and mitigate by saying it was absolutely necessary that we do so. I also want to thank those hotels that have already admitted the quarantined people, but to make also a passionate appeal. In a manner of speaking, business has been brought to you by steroids. We are appealing to you. These are people who came into the country without a plan to spend money in a hotel. If your normal charges in a hotel room are 12,000 shillings, you should be charging no more than 50% of that, or even 25% of that. This is business you didn't expect, and you are not going to get it. So to expect a person who had no plans of spending time in a hotel to spend or to pay the rates that you normally charge anybody else is again immoral and inconsiderate. So we are asking you to also charge reasonably, reduce the rate as part of your corporate, have complied with the measures we have so far announced. We continue to appeal to Kenyans to take the matter seriously and strictly observe the advisories issued, which are all aimed at containing the spread of the disease in our country. I thank you, ladies and gentlemen.
Questions? Yes. My name is Stephen Leto from Citizen TV. The issue of mandatory quarantine appears to be becoming increasingly a challenge. We have received reports of stranded visitors at the Kenya School of Government, at the same time at the Mutahi College. How is the government moving in to resolve the same? And number two is about the priest in Siaya. Maybe a brief from the ministry on the same.
Any other?
Yes. Yeah, thanks very much. Mine is, since most cases, in my own opinion, are imported, some of these entry points, and more so the JKIA, has some challenges in screening. What is being used to screen? Because if you have these imported cases, that one puts a lot of question marks in the manner of how screening is done at the major entry points, and especially the JKIA. How is it being done, and how can it be effective going forward?
Okay, let me respond, and then I'm going to ask Dr. Amos to respond more precisely in terms of the medical aspect of screening. But the simple understanding is this. First, there is no problem of screening at JKIA. As a matter of fact, that is how we picked up the Burundian national who continues to be in hospital today. I think it is important for people to understand how the disease metamorphoses, because you can walk into JKIA or any other center, no temperature, nothing, and then a couple of days later, you show the signs. So the fact that you have been screened as you pass an airport is not in itself to say that you cannot or you cannot have the disease. But I will let Dr. Amo handle that one. A priest in Siaya, yes, we are aware that there was indeed one of the 8 people I mentioned yesterday was a priest who had traveled to Rome and had come to Kenya and is currently at Bagathi, in isolation in Bagathi. We have also done contact tracing with the people he came in contact with, and it is a continuing exercise. So thank you very much, Steve. let me also say this. In regards to because you mentioned priests, I also want to say that we are very grateful to the religious bodies that have the whole day been telephoning us. Others have issued statements to say that indeed they will comply with what we directed yesterday. But I'm also a Christian myself, and I want to say that the fact that gatherings are not happening in churches and mosques does not stop spiritual and mental nourishments. You know, because when we go to church, there is spiritual nourishment. And if you notice today, the Bishop of Canterbury actually said that he will continue with his work virtually. So there is nothing to stop us from engaging with our spiritual nourishment via radio, via TV, via any other means. And there is nothing also to stop us from continuing to support our religious activities through M-Pesa, through other avenues of sending money, so that our institutions, our religious institutions, can also continue in a normal manner, even though we are not all meeting. So I want to thank them, and indeed say that we are encouraged by what they are doing, and ask them to continue praying for this country. One more, yes. Sorry? Wait. Sorry, I forgot. I think Steve had asked that question as well. Let me say this, Nasibo, that as I explained, I started by apologizing in terms of what has happened, what happened yesterday and today. Now we have got a system working. And all the people who came in this morning and last night have all been dispatched to the various centers and the various hotels. So all those people have now gone out there and settled. A lot of them are settling, others are checking in. It is going to be continuous. This evening, we are expecting more people to come in. And the method we are using now is that we will give you a choice at the airport. You'll be given the choice at the airport of where you want to go. This arrangement had not been straightened out clearly yesterday. But wherever you go, whether you go to the designated government facilities, and we are expanding them as we go along as the need arises, there will be in each facility, whether a hotel or otherwise, Ministry of Health officials who will be there with these people. There will be obviously security personnel as well in those places, essentially for protection and for help, to help those people in any manner that they may wish to get help. They are not prisoners. Let's get one thing straight. They are not prisoners. So policing is not for purposes of imprisoning anybody. It is for purposes of ensuring that there is security and they are being assisted. We are also training the hotel staff who are looking after these people so that they also don't expose themselves unnecessarily. I think it is good also to be appraised of the fact that probably none of them is positive. You know, probably nobody. So we don't want stigmatization of individuals who are themselves as healthy as you and I. The fact that somebody traveled simply makes their case necessary to test because of the exposure. But otherwise, they are not sick and they are not prisoners. And they are simply protecting themselves and then protecting Kenyans. It's a sacrifice that we all have to make. Thank you very much. I would like to ask Daktari to explain one or two things, including questions that have been asked informally here before I got here about the definition of self-quarantine. Again, you remember we explained it the last time, but I think it's good to repeat the exercise of self-quarantine. And to add also that as we do so, there are individuals who continue to abuse this freedom that has been given to them. And as that has happened, we have continued to pick them up because it is what we must do. Please, Dr. Amo.
Thank you, Waziri. Let me start by explaining what self-quarantine is. Self-quarantine means that you're in a room of your own, well ventilated, as I explained last time, probably open windows. Our best case scenario is that you have separate hygiene or toilet facilities. In case that is not possible, then after each and every use of the toilet facilities, then you require decontamination, which you can easily be able to do with jig. You take 1 part jig, maybe 1 cup jig, 6 cups of water, and you can be able to use that to be able to clean the toilet. You also, during the self-quarantine period, in case you have a coexisting medical condition, you need to have your medicines ready with you for the next 14 days. If you are working, it means you don't go to work for the next 14 days, and you keep to your room. If you are supposed also to clean your linen, your tables, your bed, you can use the same 1 part jig, 6 parts water for decontamination. You are not supposed to share any of your toiletries, your utensils, things like toothbrushes. You should use your own. That is basically what self-quarantine is. Then in terms of the screening at the ports of entry, once again I want to commend highly our officers at the ports of entry and elsewhere who are doing a marvelous job under very difficult circumstances in view of a new disease that the world has never been exposed to. And I can reaffirm Waziri's position that indeed the screening at the ports of entry is going on very well, and that is why we're able to pick one of the cases of the Burundian nation. What you need to understand is that me and you can now pass through the port of entry if I'm in the incubation period in which the virus is in my body but have not started exhibiting symptoms. So you check my temperature, it will be normal, I'll not be coughing, I'll not have difficulty in breathing. We told you last time that the average incubation period of the virus is 5.1 days. So if I pass today, the symptoms could start occurring after 5 days. So the fact that I've passed today and cleared fit to go does not mean that I'm not at risk, and that is why we are talking of self-quarantine and now mandatory quarantine, to be able to capture that period of 14 days and leave nothing to chance. Thank you.
Thank you all very much indeed.
Coronavirus is a large family of viruses called coronaviruses, and these have been there for long, and they cause diseases in both human beings and animals. In human beings, several coronaviruses cause several illnesses, with some mild like common colds and other severe illnesses. The most recently discovered coronavirus is the one we are calling COVID-19, and it is now responsible for what we are calling coronavirus disease. The symptoms generally are fever, tiredness, and dry cough, and these are usually mild, but some patients may develop aches, pains, nasal congestion, runny nose, sore throat, and some diarrhea. In 80% of clients, they usually have mild disease, and this might resolve on its own even without serious medical intervention. But 1 out of 6 patients might develop serious illness which may cause difficulty in breathing, which now calls for medical intervention. Generally, this problem is more severe in older people or people who have chronic illnesses like hypertension, diabetes, heart problems. And from the statistics we have, is about 2% of the people right now who have been affected by this coronavirus disease have died. So you can see from the statistics is that it's only a small percentage. It's not as virulent as a disease like Ebola. The virus spreads from person to person, and it is mainly if a person near you is sneezing on objects and then you hold the object and then you touch your eyes or your nose or your mouth. It also can be spread if you inhale droplets which have been which a person who is already sick has exhaled or has sneezed into the environment. And the incubation period in this matter is the period between when you get the infection and when we start seeing clear signs and symptoms. Generally, the incubation period as of now is known to be between 1 and 14 days. I should also make it clear that people should have good respiratory hygiene. So for example, if you are coughing or sneezing in public, you should sneeze into your folded arm like this, or sneeze into a serviette or a handkerchief so that you don't spread the same. And generally, if you have fever, difficulties in breathing, you should seek medical advice. So should everyone have a mask? No. Masks generally are recommended for clients or patients who already have the problem, or medical personnel who are handling this kind of patients, or a person who is assisting at home a patient who already have signs and symptoms. The county government of Nakuru is educating the public on coronavirus so that they know what is it. And two, we are giving the public information on how to prevent themselves from getting this disease in case it ever comes around. And then we've put in together a surveillance team and a response team in case we have any reports of any presence of such an incident anywhere. And we have also procured PPEs, personal protection equipment, and they are ready for use by our health personnel in case we get a client. We have also trained about 200 health personnel, that is at the Provincial General Hospital in Nakuru, at Naivasha, and Gilgil Hospital. So we have a complement of 200 personnel of all cadres. And finally, we have identified an isolated treatment facility in case there is need for such.
Okay, so we wish to make a few comments. We had met today as the Nakuru County Emergency Response Team, and this is multi-sectoral team set by the national government working together with the county government. That includes our medical professionals, our provincial administration, our security team, and all of them to ensure that we have a coordinated response to this disease. And this was our first meeting for the county. And prior to that, earlier in the morning, the county commissioner, together with our teams, visited our town center here in Nakuru. And the purpose was also to assess the risk factor. And in particular, they visited our bus park and our markets. And arising from that, several observations have been made. The first one is that there is excessive congestion in our markets, and in particular Wakulima market alongside with our other markets including Naivasha, Molo and other places. But we note that this congestion in the markets, both by the operators and also by the customers, remains our weakest link in the fight against the spread of coronavirus. And consequently, we have decided as a committee first to come up with a redistribution strategy to try and get, for example, here in Nakuru, we'll come up with about 4 different sites where we can redistribute these traders. We are thinking of areas like Shabab, for example, areas like Free Area, areas like Afra Stadium, among others, where we can redistribute these trading activities so that we don't have 5,000 traders in one place. Because when you have 5,000 traders, add a similar number in terms of those who are coming to buy, then that makes a major problem. So that is the first thing that we want to work in a team together with the market leadership, together with our elected leaders, including the MCAs and the MP, will be part of the team that will go to identify these sites starting today, and by tomorrow we hope to have settled that. We want this relocation to start by Wednesday this week, so we only have tomorrow to make sure that we correct that. We also have noted that in our rural markets, in Olenguruoni, Kihingo and many other places, we still have a problem of the market days. And the market days is when everybody from the entire village comes out, and traders come from different areas, and on Wednesday they can be in one town, on Tuesday in another town, on Thursday they can be another town. And this has also been identified by this team as a critical weak link in the spread of this virus. And consequently, we want to abolish the market days, and all other days will be the normal trading days, but there will be no market days. So for example, in Kihingo, in Joro, where the market day is on Sunday the market will be completely closed. So any other day the traders are allowed to be there, but there will be no single market day, which means that the single convergence of all traders and buyers in one place at one particular time is going to be addressed using that. And obviously we believe that it is painful for the traders and also for the buyers, but ultimately it is better to feel the pain now and realize the benefits much later than otherwise. And then we also have noted that our public service transport remains a major challenge. Our matatu operators are still not complying with the decongestion rule, where 14-seater should carry about 8. So again, working with our traffic enforcement team, we will be mounting patrols and ensuring that this is the compliance is done. For the circles that continue to flout this, we shall also consider deregistering those circles. So I think there will be clear consequences on floating these regulations that we wish to add. We also are looking at redistributing our points of boarding so that all the people who are going to Olenguruoni, to Bahati, to Njoro don't all have to come to one place. And consequently, we have also identified a team that will look at these other 4 or 5 alternative places where we can distribute our public transport boarding points. And this will be done together in consultation with their leadership. The transport sector has its own leadership, but we are happy that they already appreciate the seriousness with which this matter must be dealt with. Then allow me also to say, and this is also part of what we were discussing, that the window of us participating in breaking the cycle of infections is in the next 2 weeks. And everybody has an opportunity to participate in that. We see these entire infections more like a relay, where you run and give the next guy and the next guy and so on and so forth. So if you remove one person and you don't spread, then you break that cycle. So I think all you're trying to say is that, are you in a position where you are contributing towards the spread, and where is that position, and how can you remove yourself from that cycle so that you can break it? The consequences of not doing this are dire. Our health systems are not as advanced as some of the Western nations that are currently on their knees, and therefore we urge all Kenyans, all residents of Nakuru, all our business people who have to make huge sacrifices to appreciate that it is both necessary and important that they comply to the fullest. We will also be invoking the necessary laws to ensure that compliance is not just voluntary. There may be necessity to also to invoke some of the rules and regulations on public health that will ensure that we keep our families and our towns and our villages safe for all of us. Lastly also, allow me also to mention that we have had consultations with respect to personal behavior of individuals, and we realize that acceptance to personal responsibility is still very low. We therefore want to urge every resident of Nakuru that boarding a vehicle that is already overloaded is not a smart move. It is something that you should be the one refusing to do that. We have found places where you're supposed to go and wash your hands, long queues of people washing their hands and therefore breathing into each other and therefore defeating the purpose of keeping the social distance. So there are all these issues, and I think we will engage with the public at all levels possible, and we also urge the media to be a partner in disseminating this information. Lastly, on an unrelated matter, we have had locusts visit Nakuru for the last 3-4 days. It started in the area of Solai, El Bagon, all the way to Salga area. Today it was in the region of Subukia. It came through Bahati now, and it is in Lanet. We have been able to work with the national team on aerial spraying, and we have had significant success, but there remains one major problem, that we cannot spray in areas of heavy population density. And the areas of Bahati and the areas of Lanet and many of the other areas where they have gone are areas with very high population. So again, it's a problem that we are trying to work around, and I think we hope that once they get to areas where we can be able to do the spraying, we can do it without fear of harming the human population. That would also be another complication if we don't look into it. So I think with those few comments, I want to leave it there and to invite the County Commissioner to say a few things, and then we can invite questions or comments. Thank you. Commissioner?
Thank you, Your Excellency, for that brief. I think you have said much of what you have discussed, but I just want to talk about a few areas that we also need to look at. And our key as the county security committee has everything to do with enforcement of the directives that have already been issued by the CS Health and the PS Internal Security, and also the IG, regarding the various operations, how we are supposed to handle them as of now. Of course, all bars will remain closed, and we ask the bar owners to cooperate or be forced to comply, because it is more important for the health of the people of Nakuru for them to remain closed at least for a while, so that we can have a healthy county in future. We have realized that a few eateries are still serving food on the table. We are supposed to have a grab and go situation. Packed food, you eat it elsewhere, not sharing a table as you eat, or even eating it anywhere near the place that it's being dispensed. Then we have bars and hotels also. Of course, there have been reports of some who are trying to sell alcoholic drinks to customers who are holed up in hotel rooms, which we are also trying to discourage, because if we realize that you are doing that, we'll also recommend that your license be cancelled with immediate effect. And it is clear that quarantining now is not an option. For those who are coming from countries where there has been confirmed cases, it is a must that one has to be quarantined for at least 14 days. And we are calling out to members of the public to give us information on those who are not complying, because these people have been responsible for spreading it around in the country, and we want to break that cycle. If we can't be able to break it through that and through establishing that those we suspect have already been taken care of, then we'll have a bigger problem to deal with in a very near future. Of course, there are some other areas that I've seen some through checks. We have seen some people are not complying. Some are still carrying their kids with them to supermarkets and other marketplaces for shopping or other activities. Of course, this is not allowed. We are minimizing and we are recommending that if you are going shopping, just go alone so that you can reduce congestion in the supermarkets and other shopping areas. Of course, it is not holiday time, and we all know we are out, or the kids are out of school, or the learners are out of school for a course. So for me, ours will be just jointly with the county government, and more so the Department of Health will be out. As from today we started, will be out to ensure that everybody totally complies. Not because that we are inhuman when we deal with you, but because we want you to be safe from that disease, and we also want others to be safe. That's why we are saying obey what the government is saying. Questions can come later, because a government officer cannot just come and issue a statement for no reason. There is a well-thought reason. If you haven't understood it, kindly obey first, and then other explanations will be given later, but not the other way around. Thank you very much.
Our plan is to work with Thursday. So tomorrow we'll meet also the transport operators, and they all appreciate the circumstances we are in. So we hope that we'll have full cooperation so that we can redistribute some of these challenges and avoid putting the public into unnecessary risks. I think we have already said it. The Commissioner has said that all social places, and I think those pool tables and movie places fall into that category, are not supposed to be operating, because that's where the 20, 30 children go to congregate during the day, and therefore enhancing the risk of spread. So we will work together with our chiefs, our administrators, and everybody. And I think this is one area where we want the public to be also part of the watchdog, to help us identify them, and working with our administration will be able to ensure that the few who do not comply will be given reason to regret why they did that. Well, there's no new one. We just have two that we had that we are waiting for the results, but so far there is no other. The only thing we really want to emphasize is that for those who are coming from countries that are suspected to have or have confirmed cases, we have been made aware today that there are people who are still roaming there, fully aware that they have come from countries where the disease is prevalent, and by roaming around they continue to pose a major risk to all of us. Our plea is for them to report immediately so that the quarantine can take effect. And I think also, more importantly, members of the public. You know your neighbors, you know your friends, you know your relatives, you know your spouses. If any of them has come recently from abroad and has not taken up the quarantine voluntarily, we ask you to report that to the authorities so that you can save yourself and together save the nation. Thank you. That's okay? Thank you.
We can go check. Huh? We can go check.
Nenda so that tuongee jioni, ndio? Na nimeambia Gekari already we are doing this. I'll also talk to the MC there. If possible, comment. Yeah, now.
Sasa alikuwa kwa stage although hatukupeana
No,
broadcast.
nimewaambia. Hata kikali nimemwongelesha iko mimi.
Coronavirus is a large family of viruses called coronaviruses, and these have been there for long, and they cause diseases in both human beings and animals. In human beings, several coronaviruses cause several illnesses, with some mild like common colds and other severe illnesses. The most recently discovered coronavirus is the one we are calling COVID-19, and it is now responsible for now what we are calling coronavirus disease. The symptoms generally are fever, tiredness, and dry cough, and these are usually mild. But some patients may develop aches, pains, nasal congestion, runny nose, sore throat, and some diarrhea. In 80% of clients, they usually have mild disease, and this might resolve on its own even without serious medical intervention. But 1 out of 6 patients might develop serious illness which may cause difficulty in breathing, which now calls for medical intervention. Generally, this problem is more severe in older people or people who have chronic illnesses like hypertension, diabetes, heart problems. And from the statistics we have, is about 2% of the people right now who have been affected by this coronavirus disease have died. So you can see from the statistics is that it's only a small percentage. It's not as virulent as a disease like Ebola. The virus spreads from person to person, and it is mainly if a person near you is sneezing on objects and then you hold the object and then you touch your eyes or your nose or your mouth. It also can be spread if you inhale droplets which have been which a person who is already sick has exhaled or has sneezed into the environment. And the incubation period in this matter is the period between when you get the infection and when we start seeing clear signs and symptoms. Generally, the incubation period as of now is known to be between 1 and 14 days. I should also make it clear that people should have good respiratory hygiene. So for example, if you are coughing or sneezing in public, you should sneeze into your folded arm like this, or sneeze into a serviette or a handkerchief so that you don't spread the same. And generally, if you have fever, difficulties in breathing, you should seek medical advice. So should everyone have a mask? No. Masks generally are recommended for clients or patients who already have the problem, or medical personnel who are handling this kind of patients, or a person who is assisting at home a patient who already have signs and symptoms. The county government of Nakuru is educating the public on coronavirus so that they know what is it. And 2, we are giving the public information on how to prevent themselves from getting this disease in case it ever comes around. And then we've put in together a surveillance team and a response team in case we have any reports of any presence of such an incident anywhere. And we have also procured PPEs, personal protection equipment, and they are ready for use by our health personnel in case we get a client. We have also trained about 200 health personnel, that is at the Provincial General Hospital in Nakuru, at Naivasha, and Gilgil Hospital. So we have a complement of 200 personnel of all cadres. And finally, we have identified an isolated treatment facility in case there is need for such.